We hear so much about breast cancer and different types of cancer and diabetes, but this is February and it's Heart Month. And I really wanted to talk to you about heart disease. Did you know that it's the number one killer of women in America? Our mothers, our sisters, our daughters are dying of heart disease at the rate of one woman every minute. That translates to being about 43 million American women are affected by heart disease. 90% of women have one or more risk factors for developing heart disease. Heart disease causes 1 in 3 deaths in American women each year. And yet, despite these statistics, that heart disease is the number one killer of American women, only 1 in 5 believe that heart disease is her greatest health threat. I want you to expand your thinking about health and wellness. And we're going to do that through this organized model. So we're going to start with the physical level, then we'll move to the energy level, then the mental level, then the informational level, and then up to consciousness. So here we go. So on the physical level, as a functional medicine practitioner, one of the things that we do when we look at lab work, let's take a CBC, that just means a complete blood chemistry. We don't look at just, oh, your numbers are in range, or they're too low, or they're too high. We actually look at them in relationship to each other. Particularly in heart health, some of the numbers that I am interested in, some of the ratios and some of the patterns, of course, are your blood lipids, something called C-reactive protein that tells us about inflammation in your body, homocysteine, fibrinogen talks about sticky blood, your LDLs, and oftentimes a patient will come in with their lab work and the doctor said it was fine, but yet when I look at it from a functional medicine perspective, I see that this client is very much at risk for developing atherosclerosis, which is a precursor to heart disease. So what can we do on the physical level? Well, I think one of the first things that we can do is certainly talk to somebody who practices functional medicine, and let's begin to address the trends before the heart attack happens or before the heart disease becomes not only symptomatic, but you end up in the hospital. I'd like to suggest to you that we're energy beings. I love to play with children and we take our fingers and we rub our fingernails together and we just pause for a minute and you can feel the tingling. You can take your hands and place them on your heart and you know what? You can feel your heartbeat. We can measure heart rate. We can measure brain waves, and we do that through that second level. So how do we care for somebody on the second level? Well, we use energy. Being in nature, one of the reasons why we all love going to the mountains so much and being at the beach is because it enhances our own energetic nature.